I'm Anthony Nguyen. Join us as we change the narrative around aged care, one story at a time. Welcome back to the Pioneers in Aged Care podcast. Here we have Cara Williams, Head of Business Partnering at Bolton Clarke.
Yes.
And before we get into it, I want to introduce the sponsors because without them, I wouldn't be able to have these conversations. So the sponsors for this episode is Optimum Allied Health and Keen Care. So I'll put the links below for everyone to check them out, and their logos will be digitally included above us. Now, if you could give us, Cara, an overview as to who Bolton Clarke is, that'd be a great place to start.
Excellent. Yes, so Bolton Clarke covers the spectrum of aged care services, so all the way through from home and community support services, retirement living, through to residential aged care. We do also have a number of bespoke programs as well. So we have a homeless persons program in Melbourne. We have a research institute. We have a number of other specialised teams across the business. And then Altura Learning, which you would be aware of in terms of providing learning resources for the sector, is also part of the Bolton Clarke group.
Oh, really? Okay, I didn't realise that. Because I do see them at the conferences. I thought that was a completely separate... Was that... Did Bolton Clarke start that business, or it was acquired?
I'm not sure of the exact historical details, but has been part of the group since it was Aged Care Channel, and then obviously rebranded from Altura.
I've met a few people from there. I forget their names, but when I do meet them at the conferences, always a lively bunch.
Yes.
Cara, could you tell us about your journey into aged care and how you ended up in the role as Head of Business Partnering?
Sure. So it's probably not like the traditional answers that you would get from most of your guests. So my background is more in occupational therapy, injury management, as well as some injury prevention and safety work. So I worked in a number of other areas previously in local government, and then did some work in rehab consulting for a few years. And then about 7.5 years ago or so, I had a couple of job opportunities present, and one of them was Bolton Clarke. And at that time, it was coming in to support their self-insurance scheme, which is workers' compensation within Queensland, and their workers' comp program nationally. So, as I said, there was a few different things on the table at the time, but the work here really resonated in terms of what I've always enjoyed, which is helping people to always improve and be the best that they can. So yeah, everything felt right. So I did go with this role, and so started off team leader for workers' compensation, and then moved up through various roles. Then had the opportunity to expand that into safety and wellbeing, which again we can talk a bit more about the role itself.
Yep.
And then that's expanded quite substantially over the last few years in terms of Bolton Clarke's expansion, and then just more recently, so in the last month or so, I've seconded into a role which is more related to our people and culture business partners. So yeah, happy obviously to talk through those parts.
Let's dig into the safety and wellbeing part. I've actually got no idea. When I think of safety and wellbeing, I think OH&S.
Yeah, so definitely for us. So we operate across all 6 states, and so in terms of safety, all of the jurisdictions operate slightly differently. While there's a lot of consistent themes, there are some nuances. So we have to make sure that we're compliant with the legislative obligations across all of those different states to make sure our people are safe. So that's our staff, our volunteers, anyone working with us, but also our residents, clients, or people accessing the site. So there is definitely that component. So legislative compliance, making sure we've got everything set up for safety. But it's also the bigger picture in terms of what we can do to optimise the work that our people are doing day to day. So do our systems, do our processes set them up for success, and ideally minimise risk to their physical or psychological wellbeing. And then we have a wider, I guess, approach to that as well in terms of looking at wellbeing in general. So we look at programs to help people in terms of their physical wellbeing, mental health and wellbeing, financial wellbeing, and social connection as well. Because again, we think that if we can set up our people, to be thriving, then it's going to help them, but also set them up for success in terms of working with our clients and delivering that high quality care.
Okay. So would, because I've spoken to other people with titles governance and risk. Would your role typically be handled by them? Because I think you're the first person I've come across with this title in aged care. Okay. So you've taken more of the safety and risk side away from the clinical governance side, and you've added the well-being, because to me it sounds like a person's physical, emotional, mental well-being, if they're healthy in that aspect, then they'll operate in a safer way, reduce risk and injury.
Yeah.
Is that sort of how it all ties in? Or did I get it wrong?
In an ideal world, yes. So look, I mean, certainly for a number of the aged care providers, there are probably similar roles. Titles might change a little bit. I guess how we look at it is there's definitely crossover and interaction with those spaces. So clinical quality, risk, governance, and risk teams. For us, they are actually separate roles, but we definitely collaborate a lot and work together because there's a lot of crossover. But we do have them as, I guess, distinct roles in our organisation.
Okay. This is a good time to ask a question from the sponsor. So I've got a question here from Dane Mitchell, Managing Director of Optimum Allied Health. His question is...
G'day, Cara. As Head of Safety and Wellbeing and Head of Partnering at Bolton Clarke, you're well placed to address challenges like workers' compensation, a significant cost for aged care providers. What specific partnerships do you seek with external providers, such as those for pre-employment medicals, early intervention programs like physio and staff wellness initiatives to enhance staff safety and reduce premium costs? And what measurable outcomes have these collaborations delivered for your team, Bolton Clarke, such as lower injury claims, faster recovery times, or improved staff wellbeing?
So there's a lot in that question. I will try my best to cover it all off. I guess we are quite fortunate here. So we have quite an extensive injury management team, and a lot of our team do have allied health professional qualifications and or are really experienced claims and injury managers. So we probably don't reach out to external providers as much as some others might in terms of general rehab and return to work for our teams. But we certainly do in certain cases, and we really value those partnerships where we've got doctors or allied health professionals that really understand our industry and the nature of the work that we're doing and can work with us to help our staff get back to work and productivity as soon as possible. In terms of the program that's probably had the most benefit for us, both for our staff and their families as well as the business, is a partnership we have in the early intervention space. So what that is we do have an external provider that we work with and that really targets the first 3 weeks or so after an injury and it supports the work that our team are already doing. And what we do with that is we refer people through. They get tailored support over the phone, so telehealth type services, and what we would call psychoeducation, so helping them understand what's happened, that their reactions are quite normal, giving them advice if appropriate in terms of exercises or just getting back to normal everyday activities. And then we can also tap into things like access for hands-on physiotherapy and or psychology treatment. And what that means generally is people can get attention within a couple of hours or a couple of days as opposed to what they might be able to access in the community, which sometimes the waiting lists are weeks or months. And we've had some really positive feedback from that from our staff, as well as reducing, the absence from work and the flow on costs for things like claims and premiums. And to tap into the question about pre-employment medicals, again, I think there is a value for that. For us at the moment, we only use that service for very specific roles. So we do partner with an organisation that is able to help us turn those around really quickly. Because again, the purpose of that is wanting to make sure that someone is fit to perform the inherent requirements of the role as we've laid them out. But we also want to make sure we're not putting them in a position where we're going to aggravate a physical condition they might have or something like that. So it's about making sure it's safe for them and then also that they're in the best position to deliver the quality care to our residents and clients.
Okay. To understand your role, you're no longer in that role, you're head of business partnering now, but just to stay on topic on safety and well-being, what issues did you face in your day-to-day basis? What challenges were you always working on just so I can get a sense of the importance and what you do. So is it a matter of making sure you have buy-in from the employees to not take certain shortcuts, or?
Look, I mean, there's lots of challenges, and some of it I think is just the nature of the work that people are undertaking. So I guess we do have a few different cohorts. So if we've got staff working out in the community, they're going into people's homes, they're going into unknown environments. So there is an element of unpredictability there. We obviously look at what we can put in place to try and minimise the risk of harm to them. So that might be doing risk assessments of the actual area they're going into from a security perspective, if there's any historical incidents in that area or anything we need to be aware of. And we've got certain controls we would put in place if that's the case. It's also things like manual handling. So even though obviously we try and use equipment as much as possible to limit handling and the impact on our staff, they are still caring for residents. They are still needing to get into awkward postures at times to deliver care. So it's making sure that we minimise that as much as possible through equipment, through our techniques, but also make sure that our staff are aware of that and we can put things in place to avoid them being in sustained postures for awkward periods. Probably the biggest one, and certainly has come up in a lot of forums within aged care in recent years, is what from a safety perspective we would term occupational violence and aggression. So our staff might be exposed to certain behaviours, and again it could be from our clients or residents, could be from family members, visitors, or in the community. Sometimes it's people we don't even know that unfortunately decide that they want to say something or do something that's inappropriate and target it towards our staff. So from an incidence perspective, that's actually one of the biggest challenges that we would have.
How would you handle that?
A multifactorial approach. So again, it very much depends on the circumstances. So what we tend to see in the community is inappropriate verbal comments against our staff, or sometimes racial comments. So it's about having protocols in place to address that. If it's coming from clients or their families, obviously we work through that from a service perspective. If it's from external parties, we then again assess the risk and look at whether there's other protocols that we need to put in place to protect our staff. And that, in some areas we have even engaged security guards to accompany our staff to make sure that they're safe in delivering care, for example. In a more, clinical setting or residential setting, sometimes there is a component that is related to unexplained pain, or might be a medical condition, or it might also be related to cognitive capacity. So again, it's a really tailored approach to managing that. We try to limit as much as possible, obviously, by looking at the clinical care side of things and that real person-centred approach. But we do acknowledge sometimes that these behaviours do happen, and it's more about our staff understanding what might be potential triggers, and ideally we're avoiding it getting to that point. But if things do escalate, it's making sure that, again, we've got a process for de-escalation techniques and for support for those people.
Without then the role as the safety and well-being aspect of aged care is, now that I understand, it's hugely important, because when I speak to nurses and aged care professionals who go out to homes or have had these negative experiences, that is often one of the top 3 cited reasons as to why they don't want to work in aged care, because of essentially verbal abuse and feeling unsafe.
Yeah, it definitely factors in, and I think people react differently to different situations. Often in these sort of situations, it is a cumulative effect as well. Someone, we're not saying that they should be exposed to it at any stage, but someone might, be able to tolerate something, or they might be going okay, but then, there's one incident that's almost like the last straw for them. So for us, it's really about trying to limit that occurrence as much as possible. and also make sure that we are supportive of staff. I mean, as we know, people in this industry are, really compassionate. They're focused on caring. They'll put other people before themselves, but sometimes, that's to their own detriment. So we're really trying to raise awareness, get people to report things early so that we can intervene and hopefully avoid it getting to that trigger point. So yeah,
it's unfortunate. It's the few bad apples that really turn people away from the sector.
Yeah, I think, again, it's about really trying to change that mindset as well, that it's just part of the job. Because that's the challenge we do have in some cases, that people go, oh, well, this is just part of it, you've got to put up with it. And so we're really trying to shift that narrative as well. We can't obviously promise that there's never going to be an occurrence, but we certainly try and put everything in place we can to reduce the incidence of that and make sure that if something does occur, that we're intervening early, providing that support to the person and helping them in whatever way they need as an individual.
You spoke of the manual handling aspect and the physical toll it could take on your body. And it's funny how you've got an OT background. It's like you were made for that role. Like everything you were speaking about, I understand that's what an OT does at its core. Have you seen those exoskeletons that people can wear that help them, lift things?
I have. I mean, I wouldn't say I'm an expert in it or anything like that, but I've certainly seen their use in different settings, probably more so manufacturing or, those industrial type settings.
Yeah. And what other things are you seeing out there that could aid in safety and well-being? Whether it's innovations in technology, inventions, or whatever it is, what are you seeing out there? Because everything's changing in the next 5 years. How do you see safety and well-being evolve with different innovations?
I think there's definitely lots of scope and lots of opportunity. Some of the ones that we've tapped into previously is things like using wearable tech, so using sensors, again, to help us really look at where are the risk factors in terms of our environment, particularly for people from a manual handling perspective. But it's not just lifting, it's the postures, it's the different activities they're doing. And that was quite insightful, actually, because, again, it's not probably your traditional helping someone out of a wheelchair or something that actually shows up the highest in terms of the strain on the back or the neck. In a lot of cases, it was more to do with things like posture with the work design in a laundry setting, for example, or someone who's pushing a medication trolley but often turning their head. So that, I think there's a lot of
things you'd never think of.
No, so there's a lot of insights I think you can get from using tech like that as a bit of an enabler. The other one, which I thought was really good, unfortunately we really got impacted by COVID with this one, but we designed a virtual reality immersive experience for our staff going out into the community that we were using as part of orientation and onboarding. So that was, sending people out in the field with 360-degree cameras and working with a partner to design immersive experiences. And the whole idea of that was, again, if people weren't familiar with working in the community, getting them to look at what was in the surroundings, what might be some of the cues in terms of a potential security risk, or what could they pick up from, looking at a property, going into a building, that sort of thing. So we were getting some really good feedback and it was working really well for us for that orientation process. Unfortunately, once we got into the thick of COVID and social distancing requirements, that program fell apart a little.
It didn't get picked up again?
By the time, I guess, all the distancing and everything had been relaxed, the tech had moved on and we transitioned to different programs and different ways of working. So yeah, that was a bit disappointing on that one.
I'd imagine that would still be applicable. That does sound, because I don't think anyone's doing that at the moment. There's VR out there at the moment, but not in terms of assessing an environment.
No, I haven't heard of too many other aged care providers doing it at the moment. I've certainly seen it in other industries. So yeah, it is one, as I said, that worked really well at the time. We'd probably have to put a lot more investment into upgrading all the tech, and so we'd changed our focus a little bit. not directly related to safety, but we are actually doing a different VR program at the moment that I'm fortunate enough to be part of as part of our leadership program. And that's more about, helping people look at their core beliefs and face fears, and really that immersive experience combined with reflection from leaders. So that's one.
Is it an in-house developed VR or?
That one's through an external company. Okay. It's called Brave VR, but yeah, our leadership development specialists have partnered with them. So yeah, fortunate enough to be part of that pilot, which is really exciting.
Yeah, that's cool.
So yeah, I think there are lots of opportunities for tech. I mean, certainly, even when you look at a lot of the assistive equipment that's available in, the wider community now, there are a lot of things that we can use to reduce stress on the body for our staff, as well as improve comfort for residents and clients. So I think, there's definitely lots of opportunity. It's about what we can access to get the most benefit at the time.
Well, I've got a decent understanding of the safety and wellbeing side. Let's dig into so your role now is Head of Business Partnering.
Yes.
What does that role entail?
So working with, we have people and culture or human resource business partners spread across the country, and they're working really closely with our operational teams. So really working on the ground in terms of understanding what the business needs are and helping support those leaders working through that. I guess traditional HR sort of metrics. So we look at things like turnover, retention rates, the engagement of our staff, as well as, in some cases, if there are concerns being raised in terms of behaviours that have been displayed, or if we have to do, for example, an investigation into a CERS matter or something like that. So the team get involved in all of those activities to support the business, as well as a lot of proactive activities. So doing a lot of education, a lot of coaching of leaders, building capability, again, trying to set those leaders up for success and our wider staff.
Okay, so I guess you'd be the perfect person to ask this next question to. The other sponsor, so the other sponsor is Arav Kumar, CEO of Keen Care. What are the key factors that contribute to the success of an aged care provider, and how does technology play a role in supporting these factors?
So, I mean, again, I think there's so many factors that need to all come together effectively for an aged care provider to be functioning well. And obviously, at the centre of that is making sure that we're delivering quality care for our residents and clients. As I've sort of spoken about a lot, obviously I have a bias towards our workforce and making sure that they're set up for success. So again, I think if you've got an empowered workforce, if they're well trained, if they have the appropriate skills, then again, we're setting them up to thrive, and then that's going to create the best environment for delivering that quality care. For me, I think tech is more of an enabler to that whole process. So the more that we can use technology to limit the impacts on those staff, to improve comfort for residents, to streamline processes, to make things as easy as possible, the more time those people then have to actually deliver care, to have those one-on-one engagements with our clients and residents and really make that positive difference. Obviously there's a lot of talk about AI at the moment. Again, I think with the right constraints and guidelines in place, I think there's definitely some advantages, in terms of systems and improvements there. But again, I see that more as optimising so that people have more time for that face-to-face, one-on-one interaction. And it is something that I'm exploring a little bit at the moment, doing some extra study just in terms of applying AI in the HR space, because I think, again, there's probably some opportunities for efficiencies there, so that we can, work through that part at a systems level, and again, spend more time in those interactions with people, because they're probably what's the most rewarding for people, and also what makes the biggest difference in
Absolutely.
the end.
Now tell me about yourself, Cara. Outside of work, outside of aged care, where can we find you on the weekend? Not so much ignoring family, but I think I want to learn. Obviously, family and friends is important, the social aspect. But is it what can we find you doing when you've got all the time in the world to yourself?
I don't know if I feel like I've ever got all the time in the world to myself, but look, I definitely do enjoy getting out in nature, going for walks, exploring new places. One of the things, that I tend to talk about a lot is travel. So I do really enjoy the opportunity to go and see new places, new things.
Where have you gone recently and where are you going next?
Well, the bucket list trip that I'm planning at the moment is to Antarctica next year.
That bucket list might just end there.
So yes, I'm a little bit obsessed at the moment with planning that.
Wouldn't you need that's a whole lot of preparation and training? Would you need special training for that?
Not special not for what I'm doing. We're just going on an expedition ship. But yeah, I had to book the cruise itself 2 years in advance. So I've had it booked for over a year already. So yeah, at this stage, that's something I've wanted to do for ages.
Yeah, that's awesome.
And look, my bank balance probably won't appreciate it, but I kind of figure I'm ticking it off while I can.
That's what the bucket list is for.
Yep. And the other thing I really like is photography. So I'm actually combining this particular ship. There's a photography component to it. So there's photography lectures, special, I guess, tuition, so to speak. And yeah, so hopefully combining both of those passions. And then
how long have you been doing photography for?
Probably about 15 years or so.
Wow. You send me a few of your photos, and if you're comfortable, I can show the audience too.
I haven't. Look,
it's not for public consumption.
Yeah, I probably haven't done as much recently, or I've tended to, if I'm honest, do a lot more using phone photography than bringing out the cameras. But yeah, I can't
even tell the difference between a picture taken by a phone and a DSLR.
These days you often can't. If a lot of it comes down to the photographer, and like if they've got the vision and they're applying the techniques, oftentimes the tech itself doesn't make as much difference unless it's very specific scenarios, low light or very specifics. But yeah, so I probably about 15 years or so. I did get into some competitions and exhibitions for a while there. Officially can put some letters after my name because of that. Not that I do. And I was heavily involved in a camera club locally. I still attend, but I was the president and secretary for a number of years as well. So
that's cool.
Yeah. So
you've got this artistic side to you as well.
Try and have a bit of a creative outlet.
And it pairs well with your adventurous side. Going to those pictures in Antarctica would be amazing.
I hope so.
Yeah, I can't wait to see them.
So yeah, no, really looking forward to that one. And then yeah, other than that, much cheaper alternatives, probably things like paddleboarding, hiking.
I tried stand-up paddleboarding.
Yeah.
That is, I thought it'd be just a nice, calm thing with just standing on water. It's my feet, the muscles. I didn't realize I had muscles in my feet. I was trying to grip the thing, the board the whole time because it's not as stable as it seems. There's certain little micro muscles you need to balance on that.
Yeah, you certainly notice different muscles that you might not be aware of.
Yeah, and you wouldn't want to fall over because I can't get back on.
Yeah, I made the mistake the first time I tried it of doing it at Hamilton Island and there were waves breaking. But yeah, if you choose a calmer environment, it does work a lot better.
Yeah.
But I think it's a bit like riding a bike. Once you get it, it's a lot easier and it's more enjoyable. But yeah, if you go for kilometres and kilometres, you do feel your feet cramping up.
Yeah, your feet and then your core because you're paddling on each side.
Yep. You definitely feel it over time.
Is there anything in this conversation that you were hoping to, any message you'd like to get across, anything we didn't cover?
Look, I think we covered a bit. I mean, again, it's one of those things I could probably talk for hours depending on the topics that come up. But I think for me, again, thank you for the work that you're doing to raise awareness of aged care. And I think there's so much good work that happens in this space. Traditionally people might have a very stereotyped view, perhaps if they'd had exposure, decades ago or something like that. And there's so many good things that happen. There's great people in this industry. There's a lot that's being achieved. And I think the more that we can share that message, the better, because it really is about, positive aging. One thing I didn't talk about that I think is really good, and I really appreciate, particularly, because I'm not necessarily out at our sites all the time, is we have an internal opportunity, like a social media channel, I guess, but that really helps us connect to some of the great activities that are happening out in our site. So some of the excursions, or someone's 100th birthday, or something like that, some of the really long-standing marriages and anniversary celebrations, but as well as just day-to-day things that people are doing, and just seeing the joy on people's faces, and what they're still being able to enjoy and interact with others. I think it really helps me in terms of connecting with that purpose. But the more we can share those messages out in the general community, and people don't have this old-fashioned stereotyped idea of aged care, I think the better.
Yeah.
So yeah, thank you.
No worries. Well, I learned so much from this. Thank you so much, Cara.
No worries.
Appreciate it.
Thank you.
See you guys.